Good morning, all of you. So here, on the occasion of World Health Day, we are celebrating the 76th World Health Day. So hereby we going to conduct a special program with our esteemed presenter. So I going to call Dr. Amy, Assistant Professor, come Medical Officer, for give a health talk on World Health Day. I would like to invite you, ma'am.
Thank you, sir. Good morning, everyone. Myself, Dr. Amy, from the Department of Physiotherapy from JSS Institute of Naturopathy and Yogic Sciences, Coimbatore. I thank JSS Management and Dr. Dilip, Principal, sir, for giving me this opportunity. So, in order to raise awareness and provide information regarding World Health Day, we have initiated to provide information on maternal and newborn health as this is our theme for World Health Day 76th celebrations. So every year, starting from 1950, they are starting with any theme, one theme, according to this International World Health Day. So this year, on the campaign of Healthy Beginnings with Hopeful Futures, they have initiated maternal and newborn healthcare in order to provide best services in all over the world. So World Health Day observed annually on April 7th, highlighting pressing global issues and mobilizing actions to improve public health outcomes, started in the year of 1950. So this year, 2025, they have focused on maternal and newborn health. So it is basically to provide the maternal deaths and newborn deaths in the first line. Aligned with this vision, the Government of India, through the Ministry of Health and Family Welfare, continues to strengthen its commitment to equitable, accessible, and quality healthcare. Over the past decade, India's health sector has made notable strides through initiatives like Ayushman Bharat and the National Health Mission, which have improved maternal and child health, expanded digital health access, and enhanced infrastructures and services. So they have allotted so many campaigns, separate campaigns with the separate achievements and aims for each and every year, like Janani Suraksha and Big Me numbers and so many Lakshya like that. They are providing so many subsidiaries, and also they are helpful for all the below poverty line women also through primary health care centers. And they are providing from the beginning of the prenatal care till the after newborn care also they are providing. Indian government is playing an important very much role in the maternal and newborn health already. So India has made significant strides in improving maternal health with a maternal mortality ratio, so declining from 130 per 1 lakh persons. So now it has been reduced drastically. So thanks to government initiatives and improved healthcare accesses. So mortality rate, if you see in India, so it has reduced from 130 to 97 from the year 2014 to 2018 through these campaigns. So many campaigns they are providing in India. So drastically it has been reduced. So thanks to Indian government for very much activity compared to other nations. So coming to the maternal and newborn healthcare, so we are dividing it into the two parts. So first we'll see about maternal healthcare. So what a woman should do, it is a basic awareness we would like to create. So maternal and child healthcare, it is a basic line for every nation according to their health and wealth. So it all refers to the maternal and child healthcare. So it refers to the promotive, preventive, and curative and rehabilitative healthcare for mothers and children. So according to WHO, so this World Health Day, every year they are celebrating because of their initiatives from the World Health Organizations since 1950. Maternal and child health care services can be defined as promoting, preventing, therapeutic or rehabilitation facility or care for the mother and child. So maternal and child health refer to a package of comprehensive healthcare services which are developed to meet promotive, preventive, curative, rehabilitative needs of pregnant women before and after delivery and also the infants. First thing is the early diagnosis. So it is the duty and responsibility of each woman to go for the early diagnosis and treatments and to find out whether they have health problems for the mother and also for the child. So in order to reduce the maternal mortality and morbidity, each government has introduced this kind of early diagnosis. So we should encourage each and every woman we know to go for the early diagnosis and to go for the regular checkups and everything in order to prevent the malnutrition, prenatal and neonatal mortality and morbidity. So overall, and also for detecting the early diagnosis and also for the child survival, and also to ensure the health of the baby and also the mother, the growth and development, everything is it is being monitored in every hospitals. So we have divided as in order to reduce the maternal mortality, survival, to improve the survival rate of the child, and also for the under age 5 years of old children also they are monitoring. So there is an integrated care of approach, risk approach, manpower changes, primary health care, reproductive and child health. So every in India they are providing this kind of 5 campaigns. So complete health checkup and care of the child and mother from conception to birth, studying the health problems of mother and child, providing health education to parents for taking care of child, training to professionals. So it not only for the child and mother, Indian government is providing training for the professionals and assistance workers in working in every rural areas also they are providing. So it is very important for a woman to approach them. So this is the role of the MCH, maternal health care, family planning, and also a very important thing is the family planning. The gap of the second child or third child of the mother is very much important and also plays the important role in the mortality of the mother. So first, the maternal health care. So we are dividing maternal health care into 3 periodic changes like antenatal care, intranatal care, and postnatal care. So what is the basic aim of the antenatal care is to achieve a healthy mother and a healthy baby at the end of a pregnancy. So to promote, protect and maintain the health of the mother during pregnancy, to detect, this is the first line. So this is the primary thing of a doctor to predict the high risk cases and special attention to be given. So, and also to improve the health, overall health, to reduce the maternal and infantile mortality and morbidity, to teach the mother elements of child care. So not only about the education of the mother, but also how to take care of the children, how to provide nutrition for the children. Everything comes under this campaign. So first thing, what a mother should do. After their confirmation with the pregnancy, they should register in the nearby PHC within 12 weeks of pregnancy. So they'll be getting separate numbers for their future references and checkups. So antenatal visits. So every antenatal visit should be done in every month. So first visit at 20th week, second visit at 30th week, and third visit at 36th week. So the first visit will be about your health history, physical examination, compulsory laboratory examinations will be done. On subsequent visits, if they detect with any special care or with any gestational diabetes or BP or any other complications, they may need further investigations. So immunization. So next important thing a woman should notice is the immunization. So it is very much essential for the women to go for the regular immunization, and also home visiting references and everything they should be following up. In order to provide the best services, every woman should cooperate and also to reduce the risk. Next thing they are providing is the maintenance of records. So whatever health checkups, registration number, screening, whatever events happening, there should be the maintenance of records. And prenatal advices. So how the diet should be, what weight one woman should gain, and what is the blood levels, every hemoglobin, all the MCH values, everything should be monitored. And also every woman should know about their personal hygiene, how much time they can sleep, how much exercise they can do, dental care, and about their habits of smoking and alcohol, everything. The prenatal advices are being provided. So what and all drugs they should be taking, and what is the intimacy when they should avoid. So mostly they should avoid the intimacy relationship in the first and last trimesters. And drugs, whatever drugs, if they are feeling headache, they cannot take any medicines they need. So they should go for the physician advice what and all drugs should take. So the warning signs and how much X-rays they can be exposed, how much kilometer they can travel. So everything they are providing. So all expectant mother will be under anxiety and confusion. So they are providing psychiatric counseling also. So when they are going for hospitals or nearby PHCs, they are trying to reduce the fears and anxieties which may happen during the childbirth time, and also the specific protection from HIV, which is very important. So every woman should go for screening to detect any little bit dangerous conditions like tetanus, syphilis, and RH status and HIV infections. And the next thing is the family planning, as I have already discussed. So family planning, if the physician is suggesting for the family planning immediately after the childbirth, it is very important to follow the same. So after the family planning, it is essential to note down the pediatric components. So all antenatal clinics to pay attention to the under 5s accompanying the mothers. So childbirth is a normal physiological process, but complications may arise in like septicemia, arise from unskilled and septic manipulations, and tetanus neonatal from the use of unsterile instruments, the emphasis on the cleanliness in dentals, clean hands and fingernails. So these conditions may happen if proper cleanliness or sterilization has not been done. So it is very important for the women to look for where she is going for the birth, whether she is choosing in home or any by nearby places or well-known hospitals. So it is very essential to go for the best well-equipped centers or hospitals. So international care, the aims is to provide through asepsis. So without any infections from nosocomial infections. So it is very important for the mother to go for a safer delivery in a safer place and atmosphere. So delivery with minimum injury to the infant and mother also can be accomplished in a well-maintained, well-equipped hospitals. So readiness to deal with complications such as prolonged labor, antepartum hemorrhage, convulsions. So in order to escape from these kind of conditions, it is very essential to choose wisely the hospitals. So the main objectives of prenatal care is to prevent, for the childbirth care is to prevent infection, prevent injury to both mother and baby, to detect and deal with any complications, and to resuscitate the baby and to provide immediate care to the baby. So the next thing is the domiciliary care. It is done by the midwifery services, which is provided by our central government. So if you need any further information, you can go for the primary health centers for the same. So these are the advantages and disadvantages. So according to your atmosphere and the rural area, the mother can choose from the both. So these are the conditions for the domiciliary care provided by the midwiferys. So the first thing is the preparation of place and surroundings of confinement. So preparation of equipment and supplies acquired during delivery. So every woman should checklist for these conditions. If anything it is missing from this, a female should ready to reject the same. So physical and psychological preparation for the mother, examination of mother's physical and condition, the palpation, monitoring fetal heart sound, conducting delivery, referral of mother immediately in case of such any problems. So everything should be immediate. There should be not delay at all. So everything should, women should notice before going for the birth. So what is the postnatal care? So now we have discussed about the maternal care, what and all we should do. We should follow, we should go for screening, immunization, diet plan, everything we have read. So now it is the postnatal care. So after the delivery of the baby, what and all a woman should notice and undergo. So to restore, promote and maintain health of the mother and baby, to promote breastfeeding. So how the feeding should be done and what position should be done and what is the importance of breastfeeding. What will happen if the women skip the breastfeeding. So these are the conditions every woman should know before going for the breastfeeding session. So in order to prevent infection and identify any health problem or disorder in the baby, to support and strengthen the parents' confidence and their role within their family and cultural environment, to motivate for planned and small family norms, to educate mother and family on various aspects of mother and child care. So after the baby is born and placenta is delivered, it is very important that mother is made comfortable and watched for any complication. So whether the placenta is delivered carefully, and so for that the fundus is palpated, clots are expressed, and fundal height is measured. The perineum is inspected for any laceration or tear. Perineal care is given, and napkin is fixed. So mother is made comfortable by removing the soiled linen, through cleaning by keeping her warm, etc. Hot drink is given thereafter. The vital signs should be monitored. So these are the examinations every woman should be doing once the baby is delivered, baby and also the placenta is delivered. So soon after delivery, the health checkup must be frequent, twice a day during the first 3 days. So subsequently, once a day till umbilical drops off. And also anemia, for checking the anemia. So it is very important to check the level of oxygen circulation in the body. They will be checking with anemia, and also to reduce the chances of postpartum hemorrhage. The hemoglobin is being monitored. It is very important for the women to maintain the normal level of blood hemoglobin. So psychologically, fear and insecurity may be eliminated by proper prenatal instructions. And also family planning, basic health education, these things we have already seen. So the same thing will be following even after the postnatal care. So after once the baby neonatal care is delivered, so the clearing the airway is very much important. So immediately after the birth, baby should cry and breathe. In order to improve and provide breathing, airway needs to be cleared of mucus and any other secretions. So these are the things every child, every neonatal care should be done. Okay. So the APGAR score. So basically, it is the breathing, remains, and everything. So APGAR scoring is a device to monitor physical condition of the baby. So it is determined by immediate observation of the heart rate, respiration, muscle tone, reflex response, and how the baby, the color of the infant. It is taken 1 minute and again 5 minutes after the birth. So care of the cord should be cut and tied with when it has to be stopped pulsating. Care must be taken to prevent tetanus of a baby by unsterilized instruments and cord ties. So the care of the skin and care of the eyes are being taken, and the maintenance of body temperature, it has been monitored. So how the baby is washed with the warm and soap water and sterilized using of sterilized cloths, everything should be monitored. And also the maintenance of baby in the incubator or in the normal warm room temperature should be monitored under the degree of 36.5 to 37.5 degrees Celsius. So baby feeding. So after the hour of delivering the baby, it can be started. And also the position and the baby care, it has been taught to the mother. Physical examination. So every 2 to 3 hours, the baby is being monitored immediately after the birth. The physical examination of the baby be done by health worker assisting mother in delivery soon after the birth to identify any birth injury or any malformations and general health condition of the baby. So it is very important to give regular and frequent visits after the postnatal mother when the delivery is conducted in home. The health worker is expected to follow under mentioned schedule. First visit should be within 24 hours, and second visit 5th to 6th day, third visit on 10th day, and fourth visit on 2nd to 4th week, and fifth visit on 6th and 8th week. So during these visits, both mother and baby are given care to meet their health needs. So the care of the mother and care of the newborn. So this is the motto of this year, World Health Day. So it should be every woman and newborn should undergo this. So general observation of the mother and surrounding to access overall health status of mother and cleanliness, observation temperature, pulse and respiration, examination of breast, involutions of uterus, lochia, perineum of any kind of abnormality. In coming to the care of newborn, general observations of the baby and how she or he, observation of temperature, heart rate, and respiration is very much important. And also observing the eyes, kind of abnormality such as watering of eyes or any discharge, observation of color of the skin should be monitored. And also for the women, soon after the delivery, any observation or abnormality in the abdomen like painful or any changes in the lochia should be monitored. So every mother should take adequate nutritious diet even after the delivery. So she needs sufficient rest and sleep, and also to keep her personal hygiene well, and breastfeeds her baby. It should be seen for the baby, adequate clothing, kept clean, breastfed on demand, allowed to sleep and rest most of the time, and handled one when necessary, not given bottle feeds. Now coming to the child health care. So child health care refer to the care of children from conception to birth till the age of 5. So these are the conditions. The same thing, whether the nutritious supply, breastfeeding, immunization, their overall growth and develop should be monitored. And also it is very important for the mother and family members to give proper care to their children. And also very much important to know about the breastfeeding sessions and proper nourishment and adequate care. So it is very important for the children to get immunization. So there is a special chart which is provided in every healthcare centers, and what dosages, how many booster doses and everything should be more. It is the responsibility of the mother and family members to go for the child's immunization at the regular intervals of time. So coming to the summarization, the first thing is immunization is very much essential. Breastfeeding, monitoring regular growth and development of the baby, personal hygiene of the baby, detection of health problems and treatment. So this is the overall conditions for the mothers, children, and for the couple. So, and also every healthcare workers has the role and responsibility in the maternal and child care services. So overall, we have seen antenatal care, postnatal care, and the child health care after the delivery. So thank you for your valuable time. And we from JSS Institute of Naturopathy and Yogic Sciences and JSS Hospitals, we are ready to provide you information and raise awareness on maternal and child health care. Not only so we provide for all diseases, conditions, and preventive cure and palliative cares for geriatrics right from child health care. We are providing in JSS hospitals. We are providing online consultations also and offline consultations. So along with accommodation, we are running a hospital in Navakarai, Coimbatore. So we are pinning the address along with the phone number. So if you have any doubts and clarifications needed, you can call us. Once again, happy World Health Day. Thank you.
Thank you, madam, for sharing your valuable insight with us. So thank you all. We'll connect with other session. We'll meet again. Thank you.